Welcome to the Healthy Careers Podcast, where we help healthcare providers succeed on purpose. We take a conversational approach in learning from others who have been there and done that. Join us as we share expert insights from real people who are just like you, because we believe that success isn't just a destination. It's an intentional journey, and you don't have to do it alone.
All right, welcome back to the Healthy Careers Podcast. Today, I am excited to have Melanie with me because she is not only a fantastic physician, but also, this is now I'm just learning, a 3-time Boston Marathon runner, as well as a triathlete. So we're going to talk about a lot of different things today, including plant-based diets, what she does, why she does it, and then, what has inspired her to do all of these things outside of her demanding career as well. So welcome to the show.
Thank you, Maddie. Thanks for having me. Excited to be here.
Of course. Awesome. So I first ran into you on LinkedIn, as I do with many of my connections. And I think it's great what you're doing, number one. But if you can kind of give us just your elevator pitch, if you will, or what inspired you to do what you do.
Yeah, so I'm a non-operative sports medicine physician in Boulder, Colorado. And one of my reasons or drive to pursue medicine just was, to help people initially. I loved volunteering. I had some family members with some illnesses that inspired it. I had my own injury when I was in college and had to go to the ER. And I remember those providers taking care of me and how they made me feel safe. And I sort of wanted to be that person too. So ended up pursuing a career in medicine. And then once I started exploring the specialties a little bit more, I knew that orthopedics or sports medicine was the right fit for me with my background as an athlete. I've always grown up playing sports. I played soccer, basketball, lacrosse. Then I started getting into running more competitively and switched over to running and then triathlon. And I think my experience as an athlete, but also having a lot of injury along the way myself, I was inspired to help others get back to doing what they love to do as well. And so that was one of the drives for me for picking sports medicine. I think it's really cool to be able to help somebody and watch that progress, from that injury and then back to running or whatever activity it is.
Yeah, no, I relate to that so much. And I think it's a lot of reason why people go into sports medicine and orthopedics is that they themselves had an experience where they were like, oh, wow, without the help of this person, I wouldn't be able to do what I love. And a lot of times, at least I know for myself, now I wouldn't call myself an athlete by any means. I'm the most uncoordinated human being in the world. But, working out, lifting, and doing, fitness is kind of my mental health, right? Like it's how I stay pretty much sane. I have a stressful job and it's my happy moment. It's when I can just kind of disconnect and have that very numb, not have to worry about my to-do list. And so when you are injured, it attributes so much to that. And then to be able to see someone go from kind of being in the dumps because they can't do it to now being back into doing what they love is so special.
Yep, absolutely.
Awesome. Okay. So tell me kind of, you had your injury, you were an athlete your whole life, so you knew you wanted to go into this realm of things. What was kind of the biggest challenge for you in becoming a sports medicine physician?
That's a good question. Medicine is such a long process to go through in general, just all of the training. And, I went through everything pretty traditionally and, went from undergrad straight to medical school. So I never had that gap or break. So I started medical school all the way at age 21, so fairly young. And, ended up starting residency at 25 after I graduated medical school. And I think, residency definitely was challenging. I was an emergency medicine resident during the pandemic, and it really taught me a lot, gave me really good exposure. And I really appreciate that. I think that was one of my biggest struggles is kind of navigating those times, on the front lines during the pandemic while also trying to learn and become a really good doctor, succeed in the ER first. And, that was my priority first because any of those skills that I gained, I would take on into my fellowship. And then, fellowship was challenging in its own ways because you have to learn everything in 12 months. It's really condensed. And it was almost even harder than residency. I thought it'd be easier, but because it was so condensed and we had to work, roughly 6 days a week for about a year, it definitely was not easy getting to where I am now, but it was worth it looking back. And, everything worth having often comes with a little bit of struggle too.
100%. Yeah, I get that for sure. I have medical professionals in my family, and I remember there were times where it was like, hey, let's grab lunch. And it's like, no, I can't, I'm studying. And in my head, I was like, you can't be doing that all the time. You know what I mean? Like, come on, come out and have some fun. And it was like, there's no fun allowed these next, couple of years. But
Yeah, lots of sacrifice in your 20s, but for a lot of gain down the line is what I've kind of experienced. Just,
mhm,
seeing that transition has been really unique for me, but also very cool and rewarding. Going from that training phase to now a year out of fellowship and really functioning as a full attending and having my own autonomy and making my own decisions, doing
yeah.
all of my own procedures. So it's a lot more fun now.
Yeah, I would imagine so, because you get to put everything into work and actually, like you said, have that autonomy to call the shots rather than just working underneath somebody or feeling like you're shadowing or
Hmm.
whatever else. So that's awesome. And there's something that caught my eye too, and I know we talked about it a little bit, of just the approach of having, I guess holistic is the right word, or alternative, or not opting for just surgery, which I feel like the industry nowadays
Hmm.
is so surgery happy, and just the second that something could call for, it's like push it, right? Because that's what
Hmm.
feels the most, that's what, you know, makes the most money in the industry. But there's so much nowadays that I've found of people taking a step back and saying like, okay, how can I approach this differently? How can I do things that aren't as invasive, that aren't as intrusive,
Hmm.
and don't require as much recovery? Either not only from a proactive level, right, of like taking care of ourselves so that we prevent injury, but also, um, you know, just the athletic scene as a whole, I feel like has kind of taken more to this tune than anything else in the last couple of years. So I know that you are a huge advocate for the plant-based diet, and I would love to hear kind of when you started that, if that has been like a lifelong thing that you've done, if it's been something that you've integrated later in your life, or when you started doing these triathlons and stuff. Like, I want to know all about it.
So I actually started that all the way back my senior year of college. So I've
Okay.
been plant-based for about 10 years.
Okay.
And at the time, I knew I was going to medical school and started watching some of those documentaries that were out there on Netflix that became popular then. And that really exposed me to some of the data and science and um, how our food's produced, what we're eating, those sorts of things. I also became aware of a well-known cardiologist named Dr. Esselstyn at the time,
Okay.
and he did some of the founding research out of the Cleveland Clinic, showing reversal of coronary atherosclerosis or plaques on cardiac catheterization, where there was severe stenosis, which is dangerous and can possibly lead to a heart attack.
Yeah.
And there was 80% reversal of that after going on a low fat, whole food, plant-based diet. So I was pretty amazed when I saw that. And
Yeah.
I do have a family history of cardiac disease, and my dad has high cholesterol. So those were some inspirations at the time, as well as I noticed when I started changing to a plant-based diet, my running actually improved. I felt better, just didn't feel as weighed down, after eating, or felt, didn't feel guilty. Whereas a lot of times I felt that way when I would go out to eat more when I was not eating plant-based. Whereas now, like, I never have that. I feel like my recovery is excellent in terms of turnaround time, less soreness, those sorts of things. So that's what initially inspired it as well. My mom was also an inspiration in that regards, because we were kind of just wanting to be a little bit more mindful of our health and the environment and what we were putting into our body. So she sort of, you know, uh, started that with me, so we both kind of went in on it. And I think having
Okay.
that support system made
Yeah.
it easier at the time, because 10 years ago, it was still like, oh, what are you doing? You're vegan, or if you said you
Yeah.
ate mostly plant-based, people would kind of give you a funny look or ask a lot of questions. I think
Yeah.
that's really changed just in the last 10 years. I hardly ever get questioned now. That could also be because I am in Boulder, which is a more plant-based friendly city, but it
Sure.
is really nice in terms of seeing that evolution and
Yep.
people, leaning towards that way. And, it doesn't have to be 100%. It's not always 100% for me, but I try to make it as close as possible. And I think that's what matters. And
Yeah.
when I feel my best, I don't know if you've heard of the blue zones, but that was also
Yes.
another thing that inspired me in terms of just looking at the places where people are living the longest and the healthiest, because I want that quality of life for a long time, not just when I'm young.
Yeah,
Hmm.
exactly. No, I have, you know what? I have to give it up to you because I have tried time and time again because I know and I've seen all the same things and I've done the research and I'm like, the same way. Like I felt so good when I ate plant-based, but what's so weird too is I also felt amazing when I did carnivore. So like I have played around with all the different diets and obviously when you are healthy, it gives you a little bit more wiggle room because you're not at risk for cardiovascular disease, like I don't have any things that I need to be worried about, at least knock on wood, that I think of. And so with that, I've kind of tested the waters to see like, okay, there's so many people that rave about plant-based, there's so many people that rave about carnivore. And I felt like just in general, when I removed the processed foods is when I felt my best and when like recovery in the gym was easiest. But when I was on
Hmm.
plant-based, like you said, I felt just lighter. I didn't feel bloated. I didn't feel like if I went out to eat that I just had that kind of full feeling after where you just sit there and
Hmm.
you're like, oh, I don't want to move for 3 hours. So I did definitely see that benefit to it. And I never did it long enough to truly see, blood markers or if there was any improvement. But again, I didn't have anything to improve. I've never had high cholesterol or things like that. But the data is really interesting. And that blue zone thing too, about those like potatoes, those purple potatoes.
Yes, yeah. I have some right now, actually. I was going to cook
Yeah.
those. There's a documentary on Netflix about the blue zones too,
Yep.
and they film in each of the areas, which is pretty interesting.
Yeah, that's the one that I read about or the one that I saw. And then I think I saw one too where they basically had these people go on to like they were identical twins and they had them go on to a
Hmm.
plant-based and then one
Oh,
on was
yeah.
carnivore.
Hmm.
So it's super cool. And I love that nowadays people are actually questioning what we're putting in our body. And it's a privilege, right? Because you think about some countries where it's just like you eat what's available to you and what is locally grown or a resource. But, we have the benefit and the privilege that there's so many different resources and things available to us. But why are we not just eating, what we can grow in our backyard or what we can, I live on a farm, so we have cows and I hope I don't bother or offend you by that, but like we eat a lot of meat from our cows, but you know what? It's sustainable, it's resourceful, and we're not, buying these prepackaged things that we're just putting into our body, not knowing half of the chemicals on the ingredients list.
Hmm. Yeah, and I think the twin study that you mentioned too, they found that the telomeres, of the DNA was longer in the plant-based group, meaning that there's theoretical lengthening of life possibly by, following the plant-based diet. So I found that one of the most unique parts of that study because there wasn't really anything out like that before. The
Mm-hmm.
Game Changers was also uh, a good one too. I don't know if you saw how they took the blood samples of people who had eaten a carnivore meal versus a plant-based meal, and how the blood, you could actually see a visible difference just looking at the syringe that the blood was collected in terms of how it was thick and lipid filled in the carnivore meal, but not so in the plant-based meal.
Interesting. Yeah, I know. And I kind of probably sit somewhere in between. So I don't really love red meat. So for me, I'm more like a Mediterranean diet, I guess you could say. Like I try to
Hmm.
do kind of a mix of things, but still also make most of my plate vegetables and fruits and then, have some type of a lean type of meat of some sort, whether it's chicken or fish. But yeah, I mean, we had a friend who he was carnivore and he had a widow's maker heart attack at 30 years old.
Oh, wow.
And now there was probably some obviously like stuff that was going on beforehand that, for whatever reason he wasn't paying attention to it, but thank God he's okay. He survived it. But now he's like, I can't do carnivore, because he had an entire artery pretty much just completely blocked. So it's
Yeah, I
interesting.
mean, it is really interesting, and I know it's not, we don't have the perfect answer. Other things are involved in terms of social, a lot of those blue zones, they have a very tight-knit social community, good sleep, all of that, reduction of stress, not being in a cortisol state. So those are still things I have to remind myself too, with my career. But I try to take a balanced approach, and yeah, the more whole food plant-based, the better, if we look at the overall data.
Yeah, definitely. I agree with you. And what are your thoughts on that as far as like the protein intake? Like, how do you, because as an athlete, I mean, you're probably, if you're training for a triathlon or a marathon of any kind, I would assume that you're burning way more calories than what you're taking in. And that
Hmm.
was my biggest struggle in eating vegan or plant-based diet, is that it was really hard for me to get to that protein intake that I felt like I was used to. And I know there are ways to do it, but like, what have you found to be helpful for you?
Hmm. Yeah, so well, if you look in terms of the average protein needed for females, if they weren't working out like I am, it's about like zero point 0.6 to zero point 0.8 grams per kilogram
Hmm.
um, per day, which would only be about I don't know, roughly 60 grams, which is not very hard to
Yeah.
reach if that was just my baseline, right? But then you do have to factor in that muscle breakdown from the workouts that I'm doing. So it's supposed to be around the 1.2 to 1.6 grams per kilogram mark. So I think trying to hit 100 grams or so per day makes sense in terms of my body size and going based off that. So I will
Right.
say I don't count, but I just try to be very mindful.
Hmm.
And I often will make a smoothie on hard days just to supplement with a little bit of plant protein, just in case,
Yes.
because I'm not really counting. But
Right.
as long as you're eating, a wide variety of plant protein sources like lentils, um, oats, quinoa, brown rice, all of those are still good sources of protein, millet, and then beans, of course, and,
Yes.
tempeh or tofu, whatever works. I will say I do eat wild caught salmon occasionally as
Yeah.
well as another source of protein, but
Yeah.
mhm,
Yeah, I think fish for me, like when I eat that Mediterranean style diet, I feel my best. That's kind of what I
mhm.
try to stick to. I mean, every now and then I like a cheeseburger, but for the most part, awesome. And tell me a little bit about how you got into the triathlons, the
Mhm.
Ironman, and how you balance that with also being a physician. I mean, you have a demanding career, and then you also have to train really hard for those things.
Good question. Yeah. So I first got into running more when I was in college, and I was on our club cross country team at Wake Forest. And so, started running, getting a little bit better, and I was like, oh, I'm pretty good at this. And so I got inspired to do my first marathon my senior year with one of my friends at Wake and ended up qualifying for Boston off my first marathon. And I was like, whoa, like I didn't know I was capable of that. Let's see where we can take this. And then I did the Boston Marathon my first year of medical school. And I was battling a little bit of injury at the time, so wasn't my best performance. And then I was
Yes.
like, I'm never doing another marathon again after that. But then that turned out to be a lie. And I was like, no, I got to prove that I can do that again. I want to qualify again for Boston.
Yeah.
So after I got through all of that injury, my first year of med school, I ended up running, well, I did a 50K ultra marathon actually my second year of med school because there was some friends of mine at the running
I love
shop
how
in
you just say that
Athens.
so casually too. Like, yeah, I decided to run 50 miles in one day.
Oh,
But
it was a 50K, which is 31, but
oh, okay.
yeah.
Okay, okay. That's
Hmm.
still a lot.
It is, yeah. But my friends in Athens, because I went to medical school in Ohio at Ohio
Yes.
U, so they inspired me to get into some trail running, try something different. So I did that. Ran a couple other marathons, and then during my third year of medical school, I returned to Toledo, Ohio, which is where I'm from. And
Okay.
I did my medical school rotations there. So that was really neat to go back to my hometown and do
Yeah.
that. And then I was racing competitively for a running shop called Dave's Running Shop in Toledo, Ohio. And
Okay.
so won or got top three in a couple local races, and then, was able to do a few more marathons. And my fourth year of medical school is when I was probably in my best running shape of my life because I had more free time then. That's when I ended up breaking 3 hours in the marathon right before I started residency. And that was one of my goals. I just had, I realized I was getting faster. I ran a 3:08. I knew that it could be attainable if I worked for it.
Mhm.
And I think, that's what motivates me is setting those personal goals outside of work because it keeps me going. It keeps me on top of things, helps me stay motivated. So,
Your
and then
purpose.
I had a lot of people in my corner too, in terms of the racing team, inspiring me as well to hit that goal. So that was all, factoring in. So once I broke 3, I was content. I kind of hit that big life goal, and I ran one other marathon in residency, 3:04 still, which is pretty good considering how
Yeah.
busy I was. So that was my 10th marathon. And then at that point, I
I
was
can't
in,
even fathom running one. Oh my gosh.
yeah, it is a lot. Yeah, it was,
So
it
what
was a
is
bit
that
of,
in the mile, like per mile, if you did it
mhm.
under 3 hours?
So that was a 6:45 average for 26.2 miles.
Girl, when I tell you, like, if I hit 9 on the mile at the gym, I'm like, yeah, baby, let's go. We got an athlete up there. That is awesome. Good for you.
Thank you.
So
And
did you
so
coach throughout that?
what was that?
Did you have a coach throughout that time as well when you were in residency?
I actually didn't. So I did all the marathon training just with friends and through the racing team and kind of knowing what I knew through that and just, our
Yeah.
own workouts. And then, so I was in Florida for residency and
Okay.
the pandemic hit and there was not that much to do.
Mm.
And I was like, wow, it's so hot down here. I probably should cross train more. So then that's what inspired getting back into triathlon because I had
Okay.
done a few triathlons just when I was 18 to 21 for fun, nothing serious. And I was like, I should try this out again. Like, this would be a great opportunity because I can open water swim here. I can go to the pool year round. So ended up doing my first half Ironman. I think that was my second year of residency, and I ended up qualifying for the World Championship. And I did around a 5-hour flat first half Iron, and I was very very happy with that for my first one. No coach or anything, no serious structured training, but I did enough where I felt pretty prepared for the race.
We need to get you
So
in the Olympics.
uh,
You need to be in Paris. What are you doing being a sports medicine
yeah,
physician? Come on.
I know. That would be amazing if I could. I've never really had the time to explore that, where I
Yeah,
could get with that in terms just because I work so much. It's
yeah,
still really cool to be able to do both and then also to relate to my patients. And that's why I think it's really cool that I can do that because there's not as many physicians, I think, out there that can relate to that high level of
yeah.
performance. And so it makes me a little bit more credible, when those elite athletes come in, and that's really, it's an honor for me to be able to be that person for them, and really cool.
Well, and I'm sure you can relate just from your own injuries and the own things that you've seen
Hmm.
and be like, hey, like I was able to rehab it and get back to doing what I love too. Like we're going to get you to that same spot versus just like a we'll see how it goes type of thing. Or, it's like, and this
Or
might,
don't run, like a lot of the surgeons will say, don't run.
that's what I was told. I was basically like, I went in with my torn meniscus and now I'm not like an elite runner by any means. But like I said, it's still a huge part of like my mental health and
Yeah.
how I de-stress and have that time just to be able to zone out and not think about work and not think about anything at all other than just like, okay, keep your feet moving. And it was like, don't run. And now I was probably running 10, 15 miles a week, nothing crazy.
Hmm.
But to go from that to then nothing, your cardiovascular health and then just be lifting weights and then be told like actually also don't lift over your head, like don't do anything that's weight bearing on your knee. And you're like, so what am I supposed to do? Like I can't just not move my body. Like that's not a part of my day. Like I've got to do something.
Yeah. Yeah,
So
no, I try to advocate for trying to remain active despite an injury, or how can we modify but still do what we want to do? Or how can we get back to that after a little bit of rest or a little bit of cross training with XYZ? So I
right.
never say don't run because I know what it's like to hear that as a runner.
Yeah, I know.
Hmm.
I'm not even a runner. When they told me that, I was like, it's just the thought of getting something taken away from you that
Hmm.
does provide you that joy in any way, shape, or form, or like if you are into, just staying healthy, my first thought is like, I'm about to gain probably a lot of weight, like if I can't move my body the way I want to, what am I
Hmm.
supposed to do? And you don't want that, so I love that you take that more real and realistic approach of not just cutting everything out.
Hmm. Yeah, I mean, I usually tell my patients like a 3 out of 10 pain level is okay. as long
Yeah.
as it's not altering form or gait. And then to monitor that after 24 hours, and as long as it's not increasing by a ton, then that
Mm,
should be okay too. So I
yep.
don't advocate for 100% pain 3 while you're rehabbing. And I can speak to that too right now because I'm dealing with a bit of a proximal hamstring injury myself, and I'm still training through it, but I lightened my load and I really focused on the PT, and now I'm reintroducing that load slowly. So that's
Yep.
kind of how I frame it usually.
Yeah, exactly.
Hmm.
Sometimes their bodies just need a little bit of rest, they need to be able to recoup. And the PT, like with my meniscus, that's what I'm doing because they were like, oh, surgery is the only thing that's going to fix it. And I'm like, yeah, but if I get the surgery, like I'm still at risk for it to get re-injured or have arthritis because of it being
Hmm.
torn as it is. So, I mean, if I can do PRP and do some PT and get it to a point where I at least feel good, I mean, it's not like I'm
Hmm.
about to run a marathon. So I don't
Right.
need to rehab it to that point, but I just want to be able to feel good running a couple miles, every week. And I think that's the approach that a lot of people are taking nowadays is like,
Yeah.
let's see what I can do with my own like work and not have
Hmm.
to do surgical intervention at all.
Yeah. And that's why I love what I do, especially the PRP
Mm-hmm.
aspect, just having that alternative because I
Yeah.
actually went through a knee scope when I was 21, when I had that first
Injury.
injury during med school. And if, I didn't know much then, I was a baby med student. So, looking back, I probably would not have gone through with that surgery. I wish somebody would have talked to me about PRP then. So I think that's what also inspired me to go this non-surgeon route
Yeah.
because I've had surgery. I know what that looks like. I've had PRP though into my Achilles. It helped. And then I worked with Regenix during residency, which is kind of the founder of interventional orthopedics and stem cells. So to
Okay.
gain that exposure was what really inspired me to kind of become a PRP expert.
Yep.
And you should ask whoever's doing the PRP to maybe target, the meniscocapsular junction with ultrasound, because you can do that where you actually try to put it in the PRP surrounding the meniscus to
Huh.
try to get that to heal. And so you want to put some of it into the joint, but then also around that area.
Yeah, I definitely
Hmm.
will. I'm going this Friday and I was like super bummed because they told me I needed to have surgery. And then, like I talked to people, my brother's an orthopedic PA. We have a friend that's an orthopedic surgeon. And even he was like, I mean, yeah, if you want to completely fix it, like you'd have to stitch it surgically, but you can try the other route and see because it might heal it to a point where at least you feel comfortable. I
Hmm.
mean, there are people walking around with torn meniscuses at all
Yeah.
different degrees and they don't ever do anything about it because if it doesn't, if they're not active or they're not runners or they might just be like, oh, my knee's acting up today, and they don't
Hmm.
think twice about it. But awesome. Yeah, I definitely will look into that. Cool. And what advice would you give somebody that maybe is, you 10 years ago wanting to do something similar? Like, what advice would you give them that you feel like you wish you would have known at that point?
I feel like there's a lot of advice I could give. I think, focusing on the present because, there will be a light at the end of the tunnel. You will reach that goal. And
Yeah.
so just being really present in the moment that you're in training, I think
Mhm.
is really important and probably wish I would have done that a little bit more. I also would advocate for definitely prioritizing their own mental health first and
Mhm.
making sure that they still do those things that they love, whether that's running, swimming, whatever activity it is outside of medicine. I feel like there's this stigma or a little bit of stereotype in terms of, medicine is supposed to be our only focus. It's, the only thing that we're allowed to do. And I disagree with that completely. I think you could argue the other way, where people who physicians who take care of themselves first are going to be the best physicians out there because
Yeah.
they're going to be the most well balanced and the most focused. And that's what I've experienced in terms of, balancing those activities outside of medicine and then coming into my job and then taking the best care of patients. And I always feel my best when I'm at my best and then I can do the best for my patients. So I think
Mm-hmm.
that's really important because
100%.
that was some feedback that I had gotten in residency that sort of still sticks with me today in terms of, concern of lack of focus just because I liked to run or to go out and ride my bike.
Yeah.
You shouldn't be scrutinized for that at all. that should
No.
be encouraged. And so I really want to change that culture in medicine, in which there was a way to speak up a little bit more and to make a cultural shift in
Mm,
terms of wellness. And so, and
yeah.
they've done more wellness things the last couple years in residency programs, but it ends up being like you sit on the computer and do modules about sleep and burnout. And I'm like, that's not
Yeah.
really wellness. Like,
No.
wellness is making sure we're mentally, physically, spiritually sound so we can then do our jobs the best. So whether that means, we do go for a group run or do like a yoga class together. I mean, that's what I tried to promote a little bit more, because I
Mm-hmm.
was chief resident of wellness. And so I actually brought like a yoga instructor in.
Yeah.
Yeah, but those modules just are not not very productive. And I think we need to speak up a little bit more in terms of that, because we already have enough tasks as residents. But yeah, I think
Yeah.
my general advice would just be to be in the moment, work really hard. Obviously, that's a given. And then prioritize your own health to take the best care of your patient's health. I think those three things can really set people up for success.
Yeah. 100%. I agree
Hmm.
wholeheartedly. I think the hustle culture is great. Like, don't get me wrong. Like, I think people that have ambition, people that, can get up and be intrinsically motivated to do the things that they felt like they were called to do, where they feel like there's a purpose. Like,
Hmm.
I don't bash that at all. I am probably one of the most competitive, and like sometimes I hate how driven I am, because I'm like, why can't I be happy working at Dunkin' Donuts? Like, I feel like my stress would be way better, but it's a different kind
I
of
can
stress.
relate to
Yeah.
that.
And sometimes it's like, I feel like when you are that way, you often think like, if I'm not doing something or completing a task or achieving something, then I must be unproductive. And then it's like, sometimes not being productive is productive, because it's allowing
Hmm.
us to reset. You mentioned like the cortisol thing, right? Especially for women hormones. Like, I find
Hmm.
myself, like, when I'm stressed to the max, I'm not showing up at my best. Like, I can be, short tempered with people that I don't mean to be short tempered with. I can be,
Hmm.
you know, too hard on myself about things that really don't, mean anything. And it's just, I'm stressed out, so I'm taking it out on myself and other people. And why would you want that version of me? And so many people will get on me about like, oh, like, you can't miss a gym day. And I'm like, correct. No, because it's not that I want to sit at the gym and do that, but I know that if I work out really hard and sweat for an hour, that I'm going to be a 10 times better person for you and for myself. So like,
Hmm.
just let me go and do it without the comment, And it's the same
Yeah,
thing you said. People try to scrutinize you for doing things that are healthy habits. And I think people need to stop feeling bad for having an identity outside of their career, because that is so important.
exactly. Yes.
Yeah.
And it's been a great way that I've found, a social life too, with all my
Yeah.
running and triathlon friends. I've met amazing people
Yeah.
through that, and that keeps me going too. Just like we talked about, that social connection that's important
Mhm.
for longevity. So you can argue that it also factors in other parts, not just the cardiovascular benefit that
Right.
you're getting, but those other social connections, which is
Yeah.
great. So yeah, and I have friends, I don't know if you're familiar with Strava, but it's like the
Yeah.
app where everybody follows you. And,
Yeah.
I have friends from Florida, Ohio, West Virginia, and all because of that community, right? Where I was in my training and med
Mhm.
school and now here. And I think that's really cool.
That is really cool.
Hmm.
And I think it's something too that gives you something to look forward to outside of like when you're having a stressful day.
Hmm.
Like, okay, there's something else going on in my life outside of just this one realm of what I do. Um,
Right.
and it's
And
easy to
same
get,
thing with the races too, like kind of having that to look forward to or an excuse to travel to something. For
yeah.
me, that's motivating. I mean, I know other people probably don't want to spend their vacation doing an Ironman, and I get that. That's
That's
okay.
like marrying into a family that does
Yeah.
marathons on Thanksgiving. It's like, no,
Yeah.
I don't want to. I want to eat all the turkey and sit and be fat.
Uh, yeah, I will say I typically am one of those turkey trotters
Mm,
each year.
my family was not, but it's all right. Teach their own. I mean, I
Yeah,
think we do a walk. We do a Thanksgiving walk after we eat to digest our
that's
food.
good.
But
Better than nothing.
yeah, well, I've enjoyed this so much. I think you've made a few really, really key points for anybody that is either in medicine, thinking about getting into medicine, and just also kind of the trends and what we're seeing and what people I think are leaning towards of a more kind of natural alternative approach, and not just going towards medication and surgery 24/7. And I think, your purpose for what you do and all the things that you've been able to do outside of that is fantastic. So I appreciate you so much coming onto the podcast.
Yeah, thank you. I enjoyed our conversation, and thanks again for having me.
Yeah, of course. Until next time, everybody, I will make sure that Melanie's information is in the show notes so that if you want to connect with her on LinkedIn, or if you're in the Boulder area and you need to see somebody, she's the person to go to. So thank you again, and until next time, everybody.
Thanks for listening to the Healthy Careers Podcast, where we provide a platform for you to ask hard questions and get real answers. If you enjoyed this episode, don't forget to subscribe and share it with your friends. Stay tuned for more episodes every other Friday at 7 a.m. Eastern.